Good afternoon, everyone. My name is Sam Waters. I'm a counselor in the immediate office of the Secretary at the Department of Health and Human Services. I am pleased to welcome you on this incredibly exciting day as HHS and the Department of Education highlight the progress of months of hard work by our nation's leading medical organizations. I'm joined on stage by my colleague, Dr. Travis Smith, a senior advisor at the department. Together, he and I were tasked by Secretary Kennedy to do what at the time seemed impossible: fundamentally change the way physicians are taught to focus more heavily on nutrition. While I will let Secretary Kennedy and Undersecretary Kent discuss the changes in more detail, I think it's important to set the table of where we started versus where we have come. 11 months ago, HHS convened a roundtable with many of the leaders in the room today. We asked a simple question: what will it take to substantially increase the amount of nutrition education medical students receive? The Secretary threw out a number: 40 hours of nutrition across 4 years of medical school, starting this fall. As you can imagine, there was a lot of shifting around in chairs. No one was entirely sure what to say. But ultimately, the overwhelming response we heard was that change of this magnitude would require the medical schools to lead. So Secretary Kennedy sent us on a mission to meet with as many medical schools as we could, to build consensus, and to start to gather commitments. We held more than 100 meetings. We engaged with deans directly. We met with experts in the field who have been advocating for these change for decades. World-renowned medical leaders whose publications set the foundation of our framework. We listened, we encouraged, and at the end of the day, and I cannot stress this enough, we let the medical schools lead. We let the science lead. What emerged was a national movement: 54 medical schools in March agreeing to either 40 hours of nutrition education or a 40-hour competency equivalent starting this fall. Public-facing web pages detailing their commitments, and an army of nutrition champions leading the change. Dozens of medical schools stepping forward to answer the call. With these changes in place, our nation's foremost medical experts paved the way for generational change. Change that I am so pleased to have been a part of, and change that I know will have a lasting impact on the health of all Americans. Change that you will hear about in further detail momentarily. Before I turn it over, I want to give a special thank you to my colleagues, Dr. Travis Smith, Karen Marks and Minnie Martin in our Office of Intergovernmental and External Affairs, Rachel Fisher in the Office of the Assistant Secretary for Health, and Dr. Drew Bremer with the Office of Nutrition Research at NIH. We have also been so fortunate to have the help and support of CMS Administrator Dr. Mehmet Oz and NIH Director Dr. Jay Bhattacharya, who have both taken tremendous action to integrate nutrition into medical practice and research. And of course, our tireless partners at the White House, Callie Means and Dr. Heidi Overton, for helping championing the MAHA agenda. I also want to thank our partners at the Department of Education, Secretary Linda McMahon, Undersecretary Nicholas Kent, Assistant Secretary David Barker, and Deputy Assistant Secretary Jeff Andrade. And finally, I want to thank President Trump and Secretary Kennedy for creating this unique opportunity for change. Through our mandate to make America healthy again, we are achieving historic reforms that will have a lasting impact on improving the health of our nation. And with that, ladies and gentlemen, please join me in welcoming Secretary Robert F. Kennedy, Jr.
Hey, everybody. Thank you for being here, and special thanks to Sam Waters and Dr. Travis Brown for their leadership and all the hard work that they put into making this happen today. They put nutrition at the forefront of medical education, and it's all part of our effort to put good food at the center of the American plate. I also want to thank Congressman Aaron Bean, who's here, for his leadership on this issue and many, many other MAHA issues. Congressman Bean told me that he's changed his diet as a result of his involvement in MAHA, and that he actually cut himself. He showed me his finger making a salad for his lunch. So even real food can be dangerous. Today, HHS and the Department of Education are announcing several major reforms that will help reshape the future of American medicine. First, 9 of the nation's leading medical accreditors, certifying boards, testing organizations, and educational institutions are taking concrete action to put nutrition back where it belongs, at the center of medical education. The 9 organizations we're highlighting today are the Accreditation Council for Continuing Medical Education, the Accreditation Council for Graduate Medical Education, the American Association of Colleges of Osteopathic Medicine, the Association of American Medical Colleges, the American Board of Medical Specialties, the Commission on Osteopathic College Accreditation, the Liaison Committee on Medical Education, the National Board of Medical Examiners, and the National Board of Osteopathic Medical Examiners. Over the last 10 months, these organizations have done the hard work of reform. They reviewed standards, revised requirements, built consensus, and committed themselves to measurable change. Together, they are changing how America trains its doctors. Some of the most significant reforms came from the National Board of Medical Examiners and the National Board of Osteopathic Medical Examiners. The first time nutrition science will have a meaningful presence across all 3 steps of the United States medical licensing examination. Approximately 15% of content across the examination sequence will assess nutrition and the clinical application using evidence-based standards. The National Board of Osteopathic Medical Examiners has made a similar strong and impactful commitment on its testing of osteopathic students. That means nutrition will no longer sit at the margins of medical education. It will shape what students learn, what physicians master, what licensing boards assess, and ultimately how patients receive care. Education drives practice, practice drives outcomes, and outcomes determine the health of a nation. That's why today's commitments represent one of the most important course corrections in modern American medicine. Our next big announcement is of equal importance. 19 additional medical schools have signed the Trump administration's nutrition education pledge, committing to provide at least 40 hours of nutrition education or an equivalent for every future physician they train starting this autumn. With these commitments, 73 medical schools across the country have now joined the pledge. That's not a symbolic achievement, it is a structural change. The first 54 schools joined after months of engagement and planning by Dr. Travis Smith and Sam Waters and others. The 19 schools joining us today came forward on their own. They saw the urgency of the nation's disease burden, they saw the leadership of their peers, and they chose to act. I commend them for their leadership, but we're not stopping there. To accelerate this work, HHS just launched a $2.1 million NIH challenge to identify, reward, and to scale the most effective approaches for integrating nutrition into medical and nursing school education. Whether these solutions come through courses or workshops, teaching kitchens, coaching programs, seminar series, or entirely new models, we will find them, we'll support them, and we'll share them with everyone else. NIH will also make winning curricula publicly available so that institutions across the country can adopt what works. This is the first phase of a $5 million initiative led by Director of NIH, Jay Bhattacharya, and the Director of Office Nutrition, the Office of Nutrition Research, Dr. Drew Bremer. To understand why these announcements matter, consider the scale of the problem we face. Today, 90% of healthcare spending goes toward treating chronic disease. We calculated recently that if you include the VA and the Pentagon and the Social Security Office and my agency, we spend today about 48 cents out of every federal dollar that Americans pay in taxes now goes to healthcare, and 90% of that goes to chronic disease, most of which are linked to our food. More than 70% of American adults are overweight or obese. 1/3 of teenagers have diabetes or prediabetes, 38%. And this is not only a public health challenge, it's a national security issue. About 77% of American children can now no longer qualify for military service. That's something that should get everybody's attention. These numbers make one thing clear: we cannot solve the chronic disease burden without addressing nutrition. And that's why the commitment announced today are so important. Together, these three announcements send a clear message. Nutrition is returning to the center of the American medicine. That should not be a revolutionary idea. Yet the lack of nutrition training in medical schools is a decade-old problem, first identified by the American Medical Association in the 1960s when my uncle was president. Successive administrations have recognized and acknowledged that problem. The Trump administration finally did something about it. President Trump directed us to change course. Under his Make America Healthy Again agenda, we're putting nutrition education at the forefront of medicine and prevention at the forefront of healthcare. We're training future physicians to address the root causes of diseases, not simply manage their consequences. And we're building a medical system that gives doctors better tools, patients better information, and families a better chance to live long and healthy lives. I want to thank the leaders of the 9 accrediting, certifying, testing, and educational organizations representing here today. They chose action over complacency and reform over inertia. I also want to thank the 73 medical schools that have joined the Nutrition Education Pledge. By strengthening nutrition education for the next generation of physicians, you are helping to improve the healthcare of future generations. I want to make clear that all of these organizations came forward voluntarily. There was no coercion or pressure from my agency. We acted as a catalyst here. We did something that everybody already wanted to do. And I want to say just something additional about that. There are many people in this audience and many of the people who signed on to the pledge, both the accreditors, the testers, and the medical schools, that disagree with the Trump administration on many, many policies and disagree with me personally on many policies. And so I especially want to commend them for coming forward and say a word about how important that is. I grew up at a time of extreme polarization in our country during the 1960s. And in some ways, the polarization and violence exhausted itself with the assassinations of my uncle and then my father. But it's researched today, and it is researched in a way that humanity has never encountered before because it's driven by algorithms that pour concrete on our divisions, that push us farther and farther apart. And nobody really knows or understands how this can end. But clearly what we need to do is we need to start learning to talk to each other again, even with people with whom we disagree. And we need to be able to come together on issues on which we can find common ground. We can disagree with other people on 90% of the issues. But if there's a place that we can agree, we have an obligation to come forward and do that. I had an example when I was a kid of how of the way that works. My uncle Ted Kennedy, who was one of the farthest left members of the United States Senate, would come home on weekends with people like Orrin Hatch, like every weekend. People who disagreed with him on every issue, but nevertheless they were friends and they enjoyed each other's company. And they took time to spend with each other so that they could find common ground on issues. And as a result of my uncle's friendships with all these people who disagreed with him, he now has more legislation under his name and more bills passed that he initiated than any other senator in the United States history. And it was because he was able to reach out, and all of us need to start doing that again today. And the medical schools, the testers and accreditors who joined this effort were people who decided to put partisanship aside and the tribalism that's polarizing us aside, and to do something that was good for our country and good for our children. There are no such thing as Republican children or Democratic children. All of us want healthy kids. And this is a first critical step to making sure that the next generation of children are going to be much healthier than previous ones. I'm confident that years from now, we'll look back at this moment as a turning point in how we educate doctors, how we practice medicine, how we confront chronic disease in this country, and also maybe also a precedent for getting along with people and finding common ground on issues on which we otherwise disagree. I look forward to hearing remarks from the CMS director, my partner and friend, Mehmet Oz, about the work his team has done to advance nutrition and medicine. Unfortunately, Secretary McMahon was not able to join us today, but I'm pleased to introduce Nicholas Kent, Undersecretary of Education and Acting Deputy Secretary of Education. Nicholas, good to see you. The podium is yours.
Thank you, Secretary Kennedy, for gathering us all here today, and thank you for leading this historic change. Good afternoon, everyone. It is an honor to join you all as we celebrate another major commitment to common sense reforms that will reshape American medical training for generations to come, benefiting not only students who train to be healthcare professionals, but the scores of patients that they will serve throughout their careers. Now, as someone who started off their career at an accrediting agency that focused on allied health education, I find today's event to be particularly meaningful. Quality nutrition is the foundation of a healthy life, and that's why the Trump administration has placed nutrition and prevention front and center in how we train tomorrow's healthcare leaders. Since our last gathering in March, it is a privilege to recognize an additional 19 medical schools stepping up to strengthen nutrition education. Because to make America great again, we first must make it healthy. As you are all aware, diet-related chronic diseases contribute to roughly 1 million deaths each year and impose enormous economic and emotional costs. And a staggering 14.7 million school-age children suffer from obesity. However, our efforts are ensuring that nutrition education will no longer be overlooked as an essential pillar of public health. On average, medical schools have only required about 2 hours of nutrition education to earn a diploma. 2 hours out of years of specialized training, despite strong and growing evidence demonstrating that nutrition education is a powerful tool for preventing disease. Even more striking, a recent study found that 75% of US medical schools have no required clinical nutrition coursework. This isn't a minor training issue. It's an institutional barrier to better health outcomes, and we have got the power to fix it here today. Thankfully, President Trump's MAHA mission has taken hold across our great nation. Secretary Kennedy and Secretary McMahon have jointly urged medical education associations to study the best ways to elevate and incorporate nutrition in their programs. In March, we announced that dozens of institutions and numerous accreditors pledged their commitment to make comprehensive nutrition education a graduation requirement. Today, we build on that announcement by sharing that an additional 19 schools have recognized this growing need and joined the movement to incorporate a full 40 hours or competency equivalent of education starting this fall. At the Department of Education, we respect the independence of medical schools and accrediting bodies, but we will never mandate curriculum. But what we can do and what we will spotlight are promising evidence-based models, promoting best practices, convening leaders who are improving health outcomes, and celebrating institution-driven curricular reforms that are reforming medical education. While these commitments are groundbreaking, they are also rooted in common sense. From adding required nutrition hours to integrating competencies across all 4 years and revising assessments, these actions promise real progress toward our shared goal of a healthier America. I want to thank each school for your leadership studying this issue, implementing these changes, and making a firm commitment to restore the health of our nation. I appreciate everyone involved, from faculty to policymakers, for your work as we make America healthy again. Your dedication to evidence-based nutrition education and strong partnerships will deliver a healthier future for every American. And now it is my distinct honor to introduce Dr. Oz, Administrator of the Centers for Medicare and Medicaid Services, to share more about the Department of Health and Human Services efforts. Thank you.
Many years ago, when I was in medical school, having grown up in a family where nutrition wasn't at the forefront of our mindset, but recognizing fairly early on when I met my wife that there were families who clearly seemed healthy because they were eating well, I decided to look for nutrition classes. And I was going to school at Penn, pretty reputable medical school, and there was no nutrition class. In fact, we define nutrition class as studies of beriberi and kwashiorkor, uncommon diseases you really only find in areas that have tragic poverty and oftentimes in other continents. Turns out that was a pretty good campaign platform. I ran for student body president. I won on that platform, and we started a nutrition class. But it wasn't the kind of nutrition class we're talking about today. And I want to walk folks through where we are, both at CMS, but also with Secretary Kennedy's leadership, where this Sentinel Day allows us to go, a vision we might not have had before, and then hopefully get some insights from some of the testers, the regulators, the accreditors, and of course the medical schools themselves. When we go to medical school, we are generally not taught to stop doing things. We're not taught to just to de-prescribe medications. That was a major issue last month when the Secretary came out vocally and I think appropriately talking about the fact we never de-prescribe some of the antidepressants that are used in America. And medical communities heard that message and started talking about it a lot more. We don't talk about taking drugs down the same way we don't talk about nutrition because it's part of prevention. It's not part of the culture. And this is an important issue. If we don't learn these things in medical school, they cannot be important. Because everything we learn that's important about the health, we're going to learn in medical school. So the arrogance that's associated with not learning about nutrition in medical school contaminates the entire medical space. It's something that the Secretary appropriately wants to stop. The President noticed it, and this initiative is allowing us to address a great wrong that's been tolerated for decades. So here's the challenge. How do we make it easier to be healthy in America? Fundamentally, that is the Baja movement. And as the Secretary pointed out, with chronic disease driving most of the expenses coming from my part of the agency, it's Medicare and Medicaid, it's incumbent upon us to make the next generation of clinicians aware and activated when it comes to these issues, to give a framework for how to prevent disease by allowing things like nutrition to prosper. I do not think it's a coincidence that is generally not taught in our schools. It's not an area where clinicians think they'll make much money. It's not an area they put their pride in. I do think it's a remarkably fertile area for academicians to start pursuing careers, but we have got to get it taught in medical school to instigate this process, to get people excited about the possibility. So at CMS, here's what we're doing. As the medical schools join the commitment, with accreditors and assessors and standards organizations all engaged, we have a great opportunity to create a competency around nutrition. So let me give you two concrete examples. The Rural Health Transformation Fund, which was the single most ambitious plan to help Americans living in rural parts of the country. It's 60 million of us with a life expectancy dramatically lower than the urban parts of the country. We gave those $50 billion out with several little opportunities for states to prove themselves, including, it turns out, the opportunity to prove that they care about nutrition by including nutrition criteria in their CME testing in their states. 24 states agreed and took us up on this challenge, and they got more money, significantly more, because they're willing to teach within the CME process about nutrition. We've had medical schools started with this rural transformation funding money that are proposed. We've got whole different ways of talking about nutrition in states that historically have not been thinking a lot about nutrition, or at least it would seem so. But when their governors got wind of this opportunity to make a difference for their people, they took advantage of it. Second biggest area of focus is the hospital food themselves. Now, it is a pejorative, I think many of you would agree, to talk about the food. If you go to a friend's house and say, that tastes like hospital food. Right? It's not a step up generally from what you might have expected at a fast food restaurant. And it turns out that there are opportunities for hospitals to experiment and to improve the quality of food. One great example by my friend and Secretary Kennedy's friend, Jeff Zakarian, a world-class chef who revitalized the Tampa General food supply and was able to deliver bespoke, high-quality, real whole meals, food coming out of the ground that it looks like when you pick it as when you consume it. And he's able to do that without costing the hospital significantly more money. It was less than 5% increase in budget. Why? Because it turns out about a quarter of the traditional hospital food gets thrown away because nobody would eat it. When I was training as a resident, I was advised by the chief resident not to eat the hospital food, lest I get sick. And he wasn't kidding. And so most of us learn not to eat the food the patients eat because we won't do well with that food, especially over a long period of time. So how do we actually fix this, and how do we get to the right spot? The Secretary's pushed for pledges from hospitals all over the country. We traveled down to the Jack Nicklaus Children's Hospital in Miami to kick this process off. We've had many hospitals now, including the major organizations, embrace the idea of using the right side up food triangle, food pyramid, that we created with the Department of Agriculture in order to make sure the food that's being served in the hospitals is appropriate. And again, without a meaningful cost difference, surrounding error, frankly, compared to overall hospital expenses, it's a wise move. CMS will push these agendas and many more. Let me leave you with a quick number. $800 billion we spend roughly nationwide on prescription medications. Secretary, myself, and others have worked hard to make sure we have most favored nation drug pricing. But what is the best way to reduce the amount of money we spend on drugs? To not need them. You cannot sprinkle a Lipitor on a kielbasa and expect to save money, right? The right way to do it is to get folks to cut down on the kielbasas and other processed meats and a bunch of other things that are now mentioned appropriately in the food pyramid. I think we have been able to train physicians in a way that's very different than the way I was trained. And I'll leave you with one phrase: culinary nutrition. Because that is what actually is being discussed in medical schools. And by that, I mean, when you know lycopene is good for you, and you know tomatoes have lycopene in them, you don't chew into a tomato. Because you cannot release the lycopene from the tomato unless you skin it, boil it, skin it, and then mix it with some fat, olive oil. That's called pasta sauce. And that's why it works, culinary nutrition. So let me turn it over to the academic mind and the group who's going to speak a bit for the medical schools and some of the accrediting bodies.
Thank you for allowing me to join you today. I'm Dr. Jessica Snowden. I am a pediatrician and the Vice Chancellor for Research at University of Tennessee Health Sciences. And I will say, my teenager assumes pasta sauce is a vegetable, especially if it's on pizza. So thank you, all of you, for my fellow panelists, for inviting me to join this conversation today. As a pediatrician and a scientist and an academic health leader, I'm pleased to represent the University of Tennessee and my colleagues across the country who recognize this is an important conversation. One of the most remarkable aspects of this initiative for me really is that it recognizes something we all see every day in our clinical work and in our communities. Nutrition is not a side issue in healthcare. It's fundamental to many of the things that we need to have a healthy lifespan. Whether we're talking about healthy pregnancies or child development, cancer, diabetes, heart disease, or just being able to get into our retirement, able to enjoy it, nutrition is fundamental for all of those things, for any major health outcome that we see. At the same time, many of our communities that bear the highest burden of these chronic diseases face significant barriers to accessing healthy foods and evidence-based support. It's our job as the people who train our healthcare providers to make sure we can bridge that gap. That reality is especially true in rural communities like the one I grew up in. Many of these communities feed America, and yet they don't have access to the kinds of healthy foods, preventative services, and healthcare that they need to make sure they're as healthy as they're providing all of us to be. At UT Health Sciences, we've got tremendous enthusiasm among our learners for our current nutrition and educational offerings and culinary medicine programs. Our trainees recognize that helping patients improve their health requires more than just prescribing a medicine. It requires understanding how people live, eat, shop, cook, and care for their families where they are in the communities that they live in. Our programs integrate nutrition science, culinary medicine, and lifestyle interventions among the most those are among the most educationally engaging experiences we offer. And I'm very excited because our champion agreed to let me help teach in 2027. Our learners want more opportunities to develop those skills in culinary medicine, whether it's in our elective or in our many student interest groups across all levels of training and across all of my colleges, because we recognize the importance of food as medicine for our patients. We're looking forward to partnering with other groups through this initiative to learn new things. What have other people done that help us move this forward? In particular for us, through the Tennessee Rural Healthcare Center of Excellence, we're already working alongside state government, health systems, community organizations, local leaders, and our agricultural extension partners across the state to identify practical solutions that improve health where people live. If I give you a solution that works in urban DC, it's not necessarily going to work in small town Tennessee, and we need to acknowledge that and help people bridge those gaps. In particular, for us, our University of Tennessee Institute of Agriculture actually engages thousands of Tennesseans across the state in healthy lifestyle and nutrition initiatives in all 95 of our counties where we can meet people where they are. These partnerships are essential because lasting improvements in nutrition and health can't be achieved by any one group alone. It requires all of us to collaborate across education, across government, across agriculture, public health, and community organizations if we want to make a significant change. One of the things that is most exciting for me about this particular initiative is it's the opportunity to connect scientific evidence and nutrition education with real-world implementation. As universities, we help generate the evidence that informs what's going to move forward. We train the workforce. We evaluate outcomes to help you figure out what works and what doesn't work. And importantly, we can help you figure out how to scale things so that they are implementable in a variety of communities. Our community partners are equally important because they're the ones who help us guide these solutions to be practical, trusted, and responsive to local needs. As someone who grew up in the Deep South, if I were to come in with a Mediterranean diet today, I would get laughed out of my grandmother's house. We need to find a way to help bridge those gaps and ease people towards where they need to be. As a pediatrician, I'm particularly encouraged by the emphasis that any work on nutrition has on prevention. Many of the chronic diseases that challenge our communities begin decades before they're diagnosed. Investing in children and their families in any way, but in particularly in helping them adapt healthy nutrition and lifestyle initiatives will pay off for generations to come. I look forward to all I'm going to learn from our colleagues that have taken on this initiative and really look forward to taking action to put evidence into the implementation and help our communities be healthier. Thank you so much for having me.
Okay, thank you to our incredible speakers. We're now going to begin our Q&A. We have our ladies here with the mics. We ask that you state your first and last name and outlet, and also please focus your questions on today's announcement. I'll start with Arthur.
Thank you, Secretary Kennedy and Undersecretary Kent. You both talked about federal funding for the medical schools. What happens if they don't meet these 40-hour requirements? What happens if they don't meet the 40-hour federal funding requirement for the medical schools, these 73 medical schools? And also, Secretary Kennedy, if you can answer this question, what would the CDC be prepared to do if there is a human case of the new world screwworm in America?
So I can answer the first question as that's related to the event today. So there's no penalty if the schools are not meeting it, but they have publicly committed on a public-facing website. I think the great thing about this initiative is that we've let the medical schools be the adults in the room, right? So they've put their commitments out forward. We trust that they'll do that. They've put their name and their reputation at stake. Anybody can go to hhs.gov/nutrition-education. They can see the commitments. They can see the wonderful work that our colleagues are doing. And so we don't have any plans to do anything punitively. We think that the positive nature of this event is reflected in their work that they've posted publicly.
Great. Okay, we move on to the next one. Right there. Yep. Thank you.
Liam Cosgrove with Zero Hedge. This one's for Secretary Kennedy. It's not exactly related to this, but it is a disease that seems to be increasing that prevents people from being able to reach a healthy nutrition, and that's the rise of this alpha-gal syndrome. That is a tick-borne disease. Last month, Joe Rogan and Congressman Tim Burchett were talking about the increase of it, and even these social media reports of farmers finding boxes of ticks on their farms. They're unsubstantiated, but I'm wondering if this is something you're looking into, whether you've reached out to those farmers and found whether they have alpha-gal, whether those tick boxes are real, whether they have alpha-gal. We do know that the World Economic Forum has hosted experts who do muse about using such a disease to reduce red meat consumption. Have you seen that? Have you heard of the reports that I'm referring to?
Our press team will get back to you on that one. We want to focus on today's announcement. Thank you for your question.
Oh,
Next one. Oh, do you want? Okay.
Really quickly. We are, last week I went to New Hampshire to announce a series of programs to address this explosion of alpha-gal, and how we're taking it very seriously. One of the epicenters is Martha's Vineyard, where 50% of the adult population is now affected. It is really a devastating disease. You can't eat red meat for the rest of your life. We are looking at medications that can serve as both prophylactics and also potentially cures for it. We're funding those studies now, and we're working with the companies that are making those. We're also launched a major effort on tick control through a number of different strategies that address deer populations. The fact the three ticks that are causing most of the tick-borne diseases all breed on deer, and we're looking at strategies for limiting their breeding capacity.
And any idea if the tick boxes, whether that claim is true?
We're going to move on from that. Thanks. Next question, Carmen. Right here. Yeah.
Thank you so much. Carmen Baum from Politico. Secretary, I understand that you won't necessarily have a say. That's my computer. That you won't have a say in the curriculum, but obviously, as you know, there are disagreements in the scientific community about sort of like how much red meat to eat, how much whole milk to consume. You know, people say that could contribute to a number of chronic diseases. So I was wondering, like, sort of like, what do you have to say about that? Would you be happy if schools teach nutrition, even though they might teach stuff that you don't necessarily agree with? Like, for example, when it comes to the amount of red meat consumption, whole milk, and things like that. Thank you.
Yeah, our objective is not to dictate what the nutrition curricula should be. These medical schools are some of the smartest people in the country. They are trying to do good science. They're trying to do evidence-based medicine. They're going to come up with different recommendations and different strategies. That's a good thing for our country. These are laboratories, and people are going to learn from each other. The schools are going to learn from each other, and ultimately, that's how America works. But our job is not to dictate curriculum. We brought nutritionists from the best universities in the country together, over a dozen of them, and we basically locked them in the room for 11 months and had them come up with nutrition guidelines. Every line, every recommendation is cited and sourced. The peer-reviewed publications, government databases, other authoritative sources. We did our best. We could have made mistakes on that. We're going to constantly revise it as the science evolves. We're going to leave it up to the medical schools to figure out what the best curriculum is for their students. We know they're all committed to this, and they're going to figure out different approaches for it, but all of them are going to be, great.
Okay, we'll take one more. Paige.
Paige Winfield Cunningham with Notice. Secretary Kennedy, I wanted to ask you about nutrition in terms of food reforms. I know you promised a definition of ultra-processed foods was coming soon. There's the grass reform that's been sitting at OMB. When can we expect action on those two things?
Stand by.
Love it. Thank you, everyone, for coming. Safe travels. Thanks, everyone.